I was an anaesthetic registrar. I was called down to put an epidural into a woman who was in labour. Late at night, just me in the room and the patient and her partner. And in the hospital I was working in, we used to run through the IVs and then leave them hanging, the idea being that if it was all unpacked and hanging on the pole, it was easier and faster to access. So I put a cannula into the woman's vein, hooked up the IV and turned it on, and heard a funny gurgling noise, and was wondering whether it was leaking or not, when she then said, "I feel a bit dizzy." And the penny dropped that I'd actually connected an IV with the tubing full of air, had run a tubing full of air up her arm. That was the gurgling noise, and the dizziness was a transient cardiovascular upset from that. I must admit, she was feeling dizzy. I was waiting for the ground to just open up and swallow me once I realised that I'd done something which was potentially lethal. In this sort of setting, ordinary childbirth, everything should be fine. She settled down, everything seemed to be fine. I turned the IV off, found another one, and flushed it through. And then faced a little bit of a question about, so where do we go from here? And didn't take me an awfully long time to explain to her, A, what I had done, and B, that she was okay. Probably was going to continue to be okay, although I was wishing I had a textbook to just check on what I was saying to her at the time. But the other thing was, what were the next steps? I had done something stupid. What were the things that set me up for that? The sooner you can talk with people about what has happened, particularly when things don't go as they're planned or they go wrong, the sooner you have that conversation, the more you can work together on dealing with the situation that's at hand. If you postpone it, then you're coming in after people have had time to think and consider and worry and sometimes magnify their fears or anxieties about what might happen next, or their mistrust of the professionals looking after them has had time to go. So I think number one is timeliness, and secondly is just simple human honesty. Moving into different settings and working in different ways is challenging, but to get there you have to listen to what other people are saying, what other people want. Having said that, openness is probably challenging for patients and their families as well. It may require, or you may look for a different approach to decision making, different approaches to actually asking questions and arranging, putting options out. I think we've moved away very much from a sort of generational approach that it's the doctor or nurse knows best, but we still have to help people to have those conversations. Everybody makes mistakes, and there's two kinds of mistakes. There's the ones we know about and the ones we don't know about. And I've no idea what the ratio is, but there will be mistakes I've made that have just slid along under the radar, and I haven't had any serious outcome. It is a matter of vigilance and self-awareness around how you do that. But no, everybody makes mistakes. It's natural. What we have to do is we have to find ways to minimise the impact of those mistakes, and also look around and see if there are ways we can reduce the incidence of them.